Dr. Meeta Airen, fertility consultant at Zeeva Fertility, Noida. So, being an IVF specialist, we are very happy when the patient conceives. But once the patient conceives after an IVF treatment, they are very worried that what should be done throughout during the pregnancy, whether she should be on complete bed rest throughout 9 months of the pregnancy, or what all precautions she has to take. So today I am going to discuss with you all what is an IVF conception pregnancy and how you should behave throughout the pregnancy so that it continues till full term and you can get a healthy baby. So starting from the day of conception, once the beta HCG comes positive and the patient conceives, there are certain differences in the IVF conception as well as in normal conception. These differences are only related to the treatment part, what all medications and injections you are getting in an IVF conception. In a natural conception, you will be taking only few medications, 1 or 2 medications, that is just supplements. But because it is an IVF conception, in IVF treatment, there are many medications to be given because it has to be supported by the hormones because it is an IVF conception. So in initial 3 months of the pregnancy, if it is conceived by IVF treatment, then you have to take a lot of medications as well as sometimes injections. So these has to be taken very regularly and meticulously so that the pregnancy can be supported. As coming to the your part, that whether you can you can travel in this aspect, in an IVF conception, because it is a precious pregnancy, our main concern is your pregnancy should continue. Basically, for the traveling, it should be avoided in both the pregnancies. Either it is an IVF conception or it is a normal conception. First 3 months are little risky in terms of traveling and intercourse, so these should be avoided. But in IVF pregnancy, if sometimes the patient are having spotting, bleeding, which is possible in IVF pregnancy, in those cases your doctor might advise you to take bed rest. It depends how much bed rest you have to take, depends upon how much bleeding you have. If you are having very mild bleeding episode, then you can just be in the home, you can just walk around in the home, but more and more time you should have rest. But if bleeding is more, then you should be on complete bed rest for few days, or sometimes you might have to be admitted also if it is the bleeding is more. But in usually cases, there are few bleeding episodes like spotting or something. In those cases, you just have to be on certain injections and increase your medications, and you can be relaxedly sitting at your home. You don't have to travel a lot. Then first, once your 3 months have completed, then this pregnancy becomes more and more as equivalent to your normal, as a normal pregnancy. The only thing is you have to be more meticulous whether doctor is suggesting you anything. Your treatment also gets usually reduced after 12 weeks of pregnancy, and just normal iron, calcium, vitamin D and these type of medications will be continued throughout your pregnancy. And sometimes, yes, few other medication has to be continued till 36 weeks of pregnancy, that has to be taken properly. And you should be properly consulting your doctor throughout the pregnancy so that it reaches term and no complication occurs. One more point I want to discuss, because in IVF pregnancy there are little bit more chances of multiple pregnancies like twin pregnancies and triplet pregnancies. But if a patient conceives triplet pregnancy, then it is usually reduced to twin pregnancy at 12 weeks of gestation. That too, some medications and all to be given, and then later on it continues as twin pregnancy. If a patient conceives as a twin pregnancy, then definitely all these risks are increased. It is same for IVF as well as natural conceptions. So whenever there is twin pregnancy, all your symptoms will be more and all your risks will be more little bit. So you have to be more meticulous in all your medications and taking rests and all. Thank you so much.